Time now for our science segment, and we're joined by Julia Seeger in the newsroom. Good to see you, Julia. You're starting out with the WHO, which is raising the alarm over a massive resurgence of measles cases here in Europe, extending to Central Asia, but elsewhere too, the numbers are skyrocketing. The primary cause is the decline in vaccination rates. Tell us more.
So it is indeed a post that was on X by Hans Klug. He's the director of the WHO for the Europe region, and he says that we're witnessing an alarming resurgence. Now, he adds the number reported cases in 2023 surged. If we take a closer look, Delano, at those numbers, 42,200 cases were recorded in 2023 compared to 941 in 2022. That would be about 40-fold. Now, I want to nuance this information because here we're comparing the data from 2023 to 2022, which is actually considered to still be a post-COVID year, because in the year 2021, the viral circulation of measles was almost non-existent, and that actually continued into 2022. So it's not really representative, if you will. So what we did is that we looked at the numbers in 2019, the pre-COVID phase, and here we found. So sorry for the quality of this graph, but you can see up there in 2019 that there was 100,000 cases reported in Europe. So that's still double what the WHO has announced. Now, when we actually look closer at the data, it appears that the situation is particularly alarming in Kazakhstan, which is part of, according to the WHO, to the Europe region. And indeed, if you look at the number of cases, they have the highest incidence was 13,677 cases. That's a third of all contaminations. Now, they do alert on the fact that there are other hotspots in Europe, in England, for instance, in Russia, in Germany, but also in Romania. They're going to have to keep a close eye on that. Now, why is it concerning? Because measles is a very contagious disease, so it has an R0 of 15 to 20. That means that one person can contaminate 15 to 20 others. And it tends to heal in about 10 days, but sometimes there are complications that can even lead to death. Now, maybe one last thing, perhaps the first symptoms that should raise concern, it's runny nose, teary swollen eyelids, cough, severe fatigue, and also high fever. And it's only afterwards that you actually get the skin rash.
So what explains this surge? Is it this decline in vaccination rates?
Well, I think that's what the story is about here, is the fact that because we're still in the post-COVID-19 years, during those years there were less vaccination campaigns. People didn't vaccinate their children as much. And perhaps the WHO fears now that they're going to lose all of the efforts they had made before the COVID years. And they actually have launched a vaccination campaign, a sort of recovery plan, if you will. Now, if you look at the coverage reported for the first dose in Europe, it actually declined from 96% in 2019 to 93, for the second dose from 92 to 91. That can sound insignificant to us, but what scientists are saying is that if you want to get rid altogether and you want to curb the measles, then you have to have a vaccination rate of 95%. So that would explain why they're so alarming, perhaps. Now, here in France, they've decided actually to make it mandatory for all the children who were born after 2018.
Thank you very much for that. Julia Seeger there with our science segment. Time